Hello everybody, I'm Dr. Neha Dhivre, consultant ophthalmologist at Kokilaben Dhirubhai Ambani Hospital, Navi Mumbai. Today we are going to discuss a little bit about eye care for children. Very often I get asked what are some things that we can do to take care of our children's eyes. I'm going to give you 3 tips. The first tip is that if you ever see that your child is not performing very well at school, is going very close to the TV, is making their eyes small when they are trying to read. If something like this is happening at home, don't just shout at them or scold them. Make sure that you get an eye test done. Your child may have a glass power or refractive error, and we can always correct that with the help of glasses. The second thing, if you ever notice that your child is tilting their head to one side, if they're turning their face, or if they're not behaving normally, if you always see that their face is in an abnormal position when they're looking at something, make sure to get an eye test. The third thing, if you ever notice that one eye of your child is turning outward, inward, upward, downward, in any other direction than the other eye, this is an abnormal sign. Many times I hear parents saying that my in-laws told me, my parents told me that ये शुभ होता है, कोई बात नहीं, नजर नहीं लगती है. Sometimes people say that there are many people in our family who have a squint. But that's not the case. You can always get squint corrected. You can always get the right glasses for your child, the right treatment for your child, and help their eyes to remain aligned. The next 3 tips are in the form of FAQs that people normally ask me. The first thing and the most important that everybody these days is concerned about is screen time. So how much screen time is okay? See, frankly, today we live in a day and age where screens are everywhere. Your child may need to look at the laptop for their studies. They may need to look at a screen when they are in school or college. So a little bit of screen time that they use for their daily activities, for their educational purposes is okay. But you must ensure that they have a lot of outdoor play time, that they indulge in other activities as well, and that the entertainment is limited to off-screen activities. The next thing that most people ask me is glasses. Chashma nikal jayega na? But that's not the question. The question is, if your child has glasses, can that child see clearly with those glasses? If the vision with the glasses is perfect, that is 6/6 and N6, in that case, you must just ensure that your child wears glasses, gets their eyes checked every 6 months or so, especially if their height is growing very quickly. In this case, we can correct the power of the glasses to the child's requirements, and if the glasses are corrected, the child will have perfect vision, and it doesn't matter whether or not the glasses go away. The last thing is, should I use any drops to keep my child's eyes clean, to keep my child's eyes moist? No, not really. You don't need to use any eye drops to clean the eyes. The eyes have a self-cleaning mechanism. If ever the child has any problems, please bring them to a doctor. We'll examine them, and depending on what the issue is, we'll prescribe some eye drops. So just remember these 6 tips that we gave you today and make sure your child's eyes remain healthy.